Hi, I'm Erica, and I'm a patient of Dr. Haddock. I was diagnosed with breast cancer on my very first mammogram after I turned 40. So I came to UT Southwestern to meet with the oncology team who referred me over to Dr. Haddock. At our first appointment, we talked about a lot of options for reconstruction after mastectomy, which I didn't even know there were so many options until that conversation. So it was nice to sit with a doctor who was willing to walk me through all of my options that were available to me and not just kind of funnel me down the path of implants. It was nice to know there are other options available, especially because I am on the younger side for reconstruction. It was nice to know there was options that use my own body and things like that. So I had a bilateral mastectomy with DIEP flap reconstruction and belly button and nipple reconstruction. So a DIEP flap surgery uses my own body tissue to reconstruct my breasts. So they used my belly tissue and then moved that up to my breasts for reconstruction. The recovery honestly was a bit of a roller coaster physically and emotionally. I know I'm a bit of a high anxiety patient, so I had a lot of questions after surgery. I was constantly in my chart sending messages to the nursing staff and always got a reply back really quickly. I mean, sometimes within 20 or 30 minutes, almost always within an hour, I had a reply back to whatever question I had. But recovery tracked pretty much exactly like they told me it would. So, they have a lot of experience here dealing with that because there really were no surprises, no shocks. And anytime I had a question, it was something they'd seen a million times before, which was really reassuring. There's a couple times they squeezed me in to see an NP because I thought something looked weird, even though they reassured me it was fine, and come to find out it was all fine. So it was just really nice having such easy access to my medical team. My best advice is to ask all of the questions and don't feel like a question that you have is silly or ridiculous or pointless, because at the end of the day, you're almost rebuilding your body to a certain extent. And so make sure you find a place where you feel comfortable, like you can ask all of those questions, and where you feel like the answer you get back is satisfactory. I knew right away from our first meeting that Dr. Haddock and I were going to get along really well. He spent a really long time with me at my first appointment, walking me through what all of my options were. Implants going in was an option that I knew was available to me, but I didn't know there were so many other reconstruction options available. So I knew right away that I liked working with him because he answered all of my questions. He was super thorough, even when I repeated my questions more than once. He was really patient and re-explained everything that I was curious about. I feel like he's built a really great team because at my mastectomy, one of his team sat with me while I was crying about that surgery and held my hand and was like, at the end of the day, this first surgery is a cancer surgery and that's what we're focused on. And then after that, we'll worry about the cosmetics of it, which felt really great to me because I guess that's not what you think about when you think about a plastic surgeon. I think you kind of think they're all about the outcomes, but knowing that he's built a team that was really so aware of what I was going through on the front end was really reassuring too. So I felt nothing but comfortable with Dr. Haddock and the team that he's built. I was definitely worried going in about how much pain I would be in because the surgery that I chose for reconstruction is pretty extensive. I have an incision from one hip across all the way to the other hip. So I was definitely anxious about pain at my reconstruction surgery. There was a lot of conversation with me about what options I was interested in, what's available. I would say the first 3 days after that surgery is pretty painful. I mean, there's really no way around that. You're doing a lot of surgery, but I never felt like I was in excruciating pain or pain that I couldn't handle. The medicine they gave me in the hospital and then to take home with me kept under control to where I could still kind of function the way that I needed to, but it is a pretty long, you're looking at like 6 weeks of recovery after that surgery. So I feel like my expectation was set pretty well that, it's not going to feel great, but they were there to help me kind of manage that pain. You definitely can't do household tasks. When Dr. Haddock said 6 weeks after that surgery, I thought, okay, yeah, sure. No, that's true. 6 weeks was really until I felt kind of like I could manage my life again. And I have a really supportive husband who picks up all the slack and my mom came down, but it's definitely important to set that expectation. After the DIEP flap recovery, you will be out of commission for several weeks after. Because you can't really stand straight up, you can't really do a lot for yourself in those first couple of weeks, so my mom was here to help with all those things, doing dishes, laundry, helping me get out of bed, those kinds of things. I just really appreciate the way that they've always been super supportive and have always been available for all of my questions, because I know I ask a lot of them. And they've always been really patient and fully explain everything to my satisfaction, which has really been helpful to kind of manage my anxiety about the whole thing. Because on the patient side, I'm seeing all of this for the first time, and it's hard to not understand that I'm not looking at the final product through every stage. Like, it's all kind of a trust the process kind of a thing, which is not my strong suit. So having a team that I could lean on, and having Dr. Haddock personally call me after hours on a Friday night because something was going on with one of my dressings was so reassuring that, if everything is okay, this is how we handle this, and it's all gonna be fine. And they know that they're looking at a work in progress, even though I don't, was really helpful. And because you can see when you work with Dr. Haddock, he's kind of looking at you and seeing what the end result will look like. He can kind of visualize what is there and what it will be, kind of like a sculptor, I guess, whereas I'm looking at like what is happening. So it was reassuring to have him be like, no, this is what it's going to look like, or this is my plan, or this is how it's going to work, or this is the next step. That was always really helpful to get me to visualize, okay, this is what's going on down the road, and I'm not looking at the final product, and there is more to come and more healing. And so that's been really great.